Thanks, Carrington. The Abbott government has changed how retirees access the Seniors Health Card, and the starting date is January 2015. So what are the changes and how will they affect current and future retirees? Tony Negline is one of the country's foremost experts on super, and he joins me at the desk. How are you, mate?
Very well, Peter.
So was it an Abbott government one, or was it the Labor one that the Abbott government have actually just accepted?
No, it's an Abbott government change.
OK, right. So I didn't get that wrong. Good.
No, you're on the money there.
OK, what are the changes?
Well, what they're planning to do is if you start a pension after 1 January 2015, that will be subject to deeming. So the old age pension deeming rules, where you're deemed to get a certain amount of return, now that's typically applied to, at the moment, it's typically only applied to shares, banks, managed fund, bank products, managed funds and so on. They're going to apply that principle to pensions.
Out of your super fund?
Yeah, out of your super fund.
OK. So it's not the government pension. And so what you're painting a picture is that once upon a time, if I was a retiree receiving a super pension, it could have been a large amount of money, that was ignored.
That was ignored.
They looked at investment properties and stocks outside the super and all that sort of stuff to work out what is the extra income you're getting in, and if it was too much, you didn't get the Senior Health Card.
Correct, that's right.
Okay.
Yes.
Why have they done this, Tony?
Well, in principle, in simple form, save money.
Yeah. So
that's really all it is.
Yeah.
You could argue that it's a change that's. I wonder whether or not this is the beginning of some tax changes to pensions, pensions from super funds to those who are over 60, because they're paid tax-free, and there are other, obviously other tax concessions that are available in the Centrelink system, in the age pension system as well.
Well, I did a quick calculation. So I can imagine if someone's got $2 million in super, they don't want them getting a Senior Health Card, right?
I'd agree with that, yep.
And so the deeming rate is 3.5%, and that's 70 grand. Now, if someone's got 70 grand coming in, would that make them fail the income test?
Well, if they are a single person, their threshold is 51.5. And if they're a couple, then it's 82,400. Now, those amounts, one change that the Abbott government have introduced is that those income thresholds will be indexed each 1 July. So that's one concession, if you like. So they've taken that's one change they've brought in.
So a couple on 2 million still could get the Seniors Health Card.
Potentially.
With 2 million in there, as long as they had no other income apart from their pension.
Correct. So if you've got all your money,
so it's not that draconian when you think about it.
Look, it's not the end of the world, and this is for people who are not eligible for the aged pension because they've failed either the income test or the assets test.
By being successful.
Yeah, that's right. That's a good point. Yes. So by being they're not giving you the age pension. So it's only for those who are of age pension age who can't get the age pension.
Okay. If you start your super pension before 1 January 2015, are you free of this new change?
Yes, you are. If you are currently eligible for the Commonwealth Seniors Health Card. If you apply for any reason for that card after 1 January, the pension will be deemed. So the trick is to get in application-wise and be successful application-wise and start a pension before 1 January.
Here's a left field question, Tony, but you're the kind of guy who can bat balls coming with a curved ball from left field if they throw from left field. Anyway, the point is this. I'm in, say, a super fund, and I realise it's a really ordinary super fund. And on January 2, 2015, I switch funds.
You've started a new pension.
You've started a new pension.
Yeah, correct. So that is now's a very
great question, isn't it?
Yeah, it is a very it's a very pertinent question because there are obviously a lot of retirees who are perhaps sitting in pension funds that they're having a second thought about. If you're ineligible for the age pension, now's the time to be saying, okay, should I continue it on? There are a couple of outs for this.
Right.
One out is to stop the pension altogether and move the money back to the 15% part of your pension fund. So that means that those assets will, because there's no income in your hands, there's no deemed amount of money for the Commonwealth Seniors Health Card. So and then you could just take tax-free lump sums out of the superannuation system. You've increased your tax rate from 0% to 15%. So there's a lot of issues to think about in relation to that. There's also another issue If you could give some of that money away.
But Tony, that last one, you have to do some calculations.
Oh, you've got to do some serious calculations in relation to it.
Yeah.
And there's also another option. You could give some of the money away to your children, to whoever. You gift it away.
What's the limit of gifting?
Well, because it's the Commonwealth Seniors Health Card, there's no gifting thresholds, and there's no normally with the age pension system, there's gifting thresholds of $10,000 each year and a rolling $30,000 over every 5 years, over a rolling 5-year period. Breach those, the amount is subject to deeming. Any money once you hit age pension age in the accumulation part of your super fund is subject to deeming. So if you will get the age pension in the near future, that out that I gave you, those 2 outs I gave you, giving money away and stopping your pension, may not work long term, but they may work temporarily.
But doing giveaways, that's a cost. That might not be a...
look, there's questionable benefit.
It's a cost-benefit analysis.
It's a questionable benefit. Again, as you quite correctly said, there's serious number crunching and serious thought that needs to go into it. And given that we've got, eight or so, maybe at best 9 weeks before 1 January, you don't want to act hastily, but also at the same time, obviously, you got to move. Yeah, you got to start the thought process.
Okay, so your actions before 2015 would be what?
Well, I would reassess my pensions now and say, do I like this? Should I move? And if so, what are the benefits of moving now? Should I? So that's people who've already got a pension. Yeah. Should I? And if so, should I move before 1 January? If I move after 1 January, what's the impact? If I'm currently of age pension age, should I be looking to start a pension before 1 January?
Even if I'm still working?
Yeah, correct. Even if I'm still working. Point. Yeah, even if I'm still working, should I apply for the Commonwealth Seniors Health Card? Yeah. What am I? In other words, you've got to sit down in the cold light of day and assess your if, buts and maybes. That's what I would be doing. Should I start the pension before 1 January? And
you probably need some advice from an accountant and or a financial planner to make sure you don't screw up tax-wise on this as well.
Well, I think there are several. I think not only that, but also there may be some legal issues. So I think tax the accountant obviously, and the financial planner obviously from a product selection, and also the benefits from Centrelink and so on. Maybe FIS officers from Centrelink, etc. But also legal issues. So you might want to change your pension structures and make them reversionary, and do binding death benefit nominations and so on and so forth. So there are several issues that you might want to think about very quickly.
Tony, thanks for joining us.
Pleasure.
Well explained. Okay, that's Tony Negline. After the break, the MD of De Bortoli's Wines on a water challenge for the Murray-Darling.